Hello and welcome back to Celebrate Life, Celebrate Pregnancy. This is your friend Parinita Rohra and I am going to talk about the development of the baby at week 14. Since the 13th week you have entered the second trimester and now the baby is in the fetal period and the organs and tissues that took shape in the first trimester develop further in the second trimester. Well, so till the last week, that is in the 13th week, the baby was about 3 inches long and now this week, that is in the 14th week, the baby is around 3.4 inches long. Last week, it weighed around 23 grams and this week, it weighs around 43 to 44 grams. So its weight has almost doubled in a week. Proportion-wise, its head is still large in proportion to the rest of the body, that is 1:3, wherein one part is the head while two parts are the body. Just like week 13, even in week 14, the baby's brain is growing and functioning while the heart is beating twice or thrice as fast as yours. And we need not worry about that as this is completely normal. Its eyes are continuing to move away from the sides of the head and are drawing closer to one another, and the ears continue to shift into their correct positions by moving to the sides of the head. The fine hair that make up the eyebrows are coming together as we saw last week, while the neck is growing longer and the baby's chin is lifting from its chest. The baby also continues to form the vocal cords and teeth. As we already know, the baby's fingers and toes have separated, and also we learnt last week that although the baby is so tiny, it already has some fingerprints. During an ultrasound examination, you will be able to see that the baby is opening and clenching its fists and also spreading its fingers. It may be sucking its thumb and wiggling its toes, also making facial expressions like frowning or squinting. We also saw last week that the placenta is allowing the transfer of blood through the bloodstream from mom to baby. The baby is drawing all its nutrients, vitamins, minerals, fats, proteins and oxygen directly from the placenta. So as you can see, the baby is fully developed and is growing larger and the systems are continuing to expand. The baby's abdomen too continues to grow, allowing the intestines to continue to move into their proper place, that is from the umbilical cord to their more permanent place, that is in its tummy or the abdomen. The pancreas is producing insulin, which helps in regulating sugar levels after childbirth throughout life. The baby has a functional intestinal system. The ovaries or testes are fully developed inside the body and the genitals are forming outside the body. The bones continue to harden just like last week. And something new that's happening this week is that it's getting fuzz-like hair all over its body that will help to keep it warm. The baby's kidneys are making urine. Around now, the baby begins to swallow little bits of amniotic fluid which pass into the stomach. The kidneys start to work and the swallowed fluid passes back into the amniotic fluid as urine. Along with this, the liver of the baby begins to produce bile while the spleen begins to produce red blood cells. So the kidneys, liver, spleen and pancreas all are at their job. So hopefully all is well with the baby inside you and you so far. We will continue to see the baby's development in our next video, Celebrate Life, Celebrate Pregnancy, week 15. Given below is our email ID. Do send in your queries and feedback to us. Also, do subscribe to our channel. Breathe, chill, relax. Thanks for watching.